Hello everyone, this is Chapter 10, Issues in Theory and Practice. So the critical issues we'll be covering in this chapter include developing a counseling style, goals of counseling, counseling techniques, and assessment and diagnosis. So here are the pertinent ACA codes to consider for this chapter. First is code A2C, Developmental and Cultural Sensitivity. Next is code C7A, Scientific Basis for Treatment. Then there's code C7B, Development and Innovation. Next is code C7C, Harmful Practices. And then finally, there's code D1A, Different Approaches. And again, I won't be reading all of these. They're here on the slide as well as in the Code of Ethics. Developing a counseling style. So ideally, the theoretical approach you use to guide your practice is an expression of you as a person and is the result of intensive study, reflection, and clinical experience. And so our theory is kind of constantly evolving, especially when we first set out as counselors. And so you'll learn more about theories and what, theoretical orientations resonate with you the most as you learn more in your theories class. So I won't elaborate too much on theory here, but what I will say is that your theory will kind of inform the style of counseling that you use. So ultimately, your counseling orientation and style must be appropriate for the type of counseling you do and the unique needs of your client. So even though you might have a theory unique to you, that still needs to be adapted to the needs of your clients on an individual basis. And theories of counseling, which again you'll learn more about in your theories class, but they're based on worldviews, each with its own values, biases, and assumptions of how best to bring about change in the therapeutic process. And so again, your chosen theory will be based on what resonates with you the most. And the theory that you choose now might not be your theory a year from now, a month from now. So it just depends. It usually depends on who you are in the moment. So continuing with developing a counseling style, something to keep in mind is that many of the assumptions of contemporary theories are inappropriate for evaluating clients from cultures that focus on interdependence, downplay individuality, and emphasize being in harmony with the universe. So you want to make sure that you are still working from the perspective of your client's best interest, because sometimes the tenets of your theory might clash with where and who your client is culturally. And then next, a theoretical orientation is not a rigid structure that prescribes specific steps of what to do in a counseling situation. Instead, view it as a set of general guidelines that counselors can use to make sense of what they're hearing and what needs to change. So if you're operating from a certain theory, you don't have to think that you can only operate within what that theory, quote unquote, tells you, because it just gives you a working point, somewhere to work from. It doesn't dictate everything that you do within the counseling relationship and in the counseling process. Next is deciding on the goals of counseling. So coming up with counseling goals is a collaborative effort between you and the client. So both therapist and client should clearly understand the goals of their work together and the desired outcomes, because outcomes is how you measure your progress and how you're reaching the goals in the therapeutic process. And so the aims of therapy are specific to a particular culture's definition of psychological health. No single approach is equally effective in working with all client populations. In a managed care system, the goals will need to be highly specific, limited to reduction of problematic symptoms, and often aimed at teaching coping skills. So in a managed care system, these are typically going to be your residential or sometimes outpatient clinical settings where clients come in for a specific goal and they're learning how to basically manage themselves as individuals and learn how to function or relearn some functioning. And so you are guiding them through that with very specific steps and coping skills. In crisis intervention, goals are likely to be short-term and functional, and you may be much more directive. So in a crisis situation, it's largely focused on solution and helping the client in the present moment. So you might be more directive, and depending on your counseling style that can be uncomfortable for some people who prefer to be less directive. And in schools, you may have to combine educational goals and therapeutic goals. So if a child is struggling with their grades, you might incorporate that with the work that you're doing with them on all the other aspects of therapy, socially, emotionally, all of those different things. So, using techniques in counseling, again, a lot of this is informed by the theory that you're operating from, but also keep in mind that you need to function with intentionality when you're working with clients. We're not just kind of throwing things at the wall to see what sticks, or sometimes we are, but that has to have intention behind it. You must have a clear understanding and a sense of expected outcomes of chosen interventions, and so these are, of course, being discussed with the client. Some techniques appear to be more effective with particular symptoms and disorders, specifically for behavioral symptoms, so you might want to consider those depending on the needs of your clients. The therapeutic alliance enhances the quality of the working relationship. So the stronger your therapeutic relationship is, then the easier it can be to employ techniques because the client trusts you and you're helping them to trust themselves to carry out certain interventions. And finally, the techniques counselors employ, although important, are less crucial to therapy outcomes than are the interpersonal factors operating in the client-counselor relationship. So it's really, really important to prioritize strengthening and building that therapeutic relationship, because nothing will be accomplished if that alliance is not strong between you and the client. All right, so here are some ethical and legal issues in assessment and diagnosis. So some practitioners who are opposed to a diagnostic framework take the path of least resistance, giving every client the same diagnosis. There are some mental health professionals who do not believe in the system of diagnosing, and so just might give a general diagnosis to satisfy insurance companies and things of that nature. So keep that in mind. Presenting an acceptable, quote unquote, but inaccurate diagnosis is both unethical and fraudulent. So doing the bare minimum in diagnosing can be fraud and unethical at best. Also, it is an ethical and sometimes legal obligation of therapists to be mindful that a medical evaluation is many times indicated. So some diagnoses might need the support of a medical evaluation, and that needs to be documented and recommended by you before finalizing any diagnosing. And competence in using the DSM appropriately is an ethical issue, and you will learn so much more about that in your diagnosis and psychopharmacology course that you will be taking in the fall. But it's important to know how to use the DSM properly. Cultural issues in assessment and diagnosis. The DSM is based on Western American assumptions, which limits its usefulness among different cultural groups. So a lot of the criteria for certain diagnoses in Western culture can just be a cultural factor in a different culture. So it's important to take that into account when giving out diagnoses. For example, struggle to maintain or make eye contact. It can be an indicator of anxiety or depression and a bunch of other diagnoses according to the DSM. However, in some cultures, it's frowned upon to make direct eye contact with people or to make eye contact with people seen as authority figures. So again, it's just really important to take into account someone's culture when you're assessing them for a certain diagnosis. Cultural sensitivity is essential in making a proper diagnosis, again, because of those previous factors, understanding that cultures differ from the culture that we're used to. It's important to have that in mind when doling out diagnoses. Failure to give adequate weight to cultural factors can result in misdiagnoses that perpetuate stereotypes based on race, ethnicity, gender, and sexual orientation. So if we misdiagnose someone based on cultural factors, it is doing harm to a client. And so accurate assessment and diagnosis involves taking into consideration realities of discrimination, oppression, and racism in society and mental health disciplines, and how that is impacting how your client sees themselves, how you yourself are perceiving the client. So all of these things have to be at the forefront of your mind to make accurate diagnoses, and just make sure to give extra attention to avoiding misdiagnosing and pathologizing certain cultural groups. So just because it's not your particular cultural norm doesn't mean that it in and of itself is abnormal. So that needs to be taken into consideration as well. So now we've arrived at tricky ideas, otherwise food for thought. So the first thing we want to have in mind are the ethical considerations of diagnosis, including factors of insurance and implications of assigning diagnostic labels in medical records, because those records follow a client. So you want to be really, really careful about what diagnoses you're giving them and the justifications you make for diagnoses, making sure that that is something you want to have attached to them and to you going forward. And then also there's defining evidence-based practice and the role of research in counseling. So the mental health field is constantly evolving, new information is coming out, new research is coming out, and so it's important to stay up to date with that, and also using evidence to support the decisions that you make in counseling going forward, and considering what you'd like to contribute to that. Weird in Wyoming. So once again, these are those factors that are unique to the culture of Wyoming. So the first one is that there's a strong stigma about help seeking and diagnostic labels in the culture of cowboy up, when everybody is expected to kind of power through things and not let their problems show on their sleeves. And so if you find yourself diagnosing a client, just be sure to support them in that diagnosis and validate them, because they are fighting against what the stigma of that diagnosis might mean about them according to their perception. So it's really important to really explain a diagnosis with the clients here in Wyoming and just support them through just the fact that they have a diagnosis. And then next, there are public misconceptions about ethical practice and roles of professional counselors in the community. So not everyone understands the counseling profession here in Wyoming, and it's often conflated with other mental health professions. And so be careful that when you embody that role, that there are certain expectations attached to that in the community based on their perceptions of other mental health professions that they've seen. And so just making sure that you are acting and carrying yourself within the scope of the counseling profession. And that concludes this lecture for chapter 10. Again, if you have any questions or things you'd like to discuss, feel free to reach out to Amanda or myself via email, or check in with us in one of the Zoom drop-in sessions that we'll be having throughout the semester. Thank you so much.